Heinze became an amputee at age 19 as a result of falling into a 30-inch power circular saw while working on a farm. Since his accident, Art has been successfully rehabilitated, completed his education, and is now employed as a registered occupational therapist with 24 years' experience. He is married and the father of 3 sons. In this video, Art would like to share with you the psychosocial adjustment that he went through as a traumatic amputee, talk about the levels of amputation, the types of prostheses, the component parts of a prosthesis, demonstrate how a prosthesis works, and some leisure time activities and daily tasks. Ladies and gentlemen, Art Heinze.
Needless to say, having a traumatic accident at age 19 was quite devastating. Fortunately, no one panicked at the accident site, and I was rushed to the hospital. Knowing I was near death due to blood loss, I was reviewing my life on the way to the hospital. I was wondering, what type of person was I? What type of life did I live? Was I ready to die? I made it through my acute care and then was ready for rehabilitation. At the beginning of my rehabilitation program, I had a very helpless, hopeless feeling. Will I ever again be a productive member of society? Will I be a burden on my family or a burden on society? I was going steady with a girl at the time. Will my girlfriend still want me? My self-esteem was at an all-time low. I was unsure of my future. I was dependent on others for everything. I remember even being angry at God. I questioned, why did God do this to me? I also questioned, was I being punished? Why me? I wondered if I could go through life as an amputee. Will I ever again be able to do anything? Will I be able to endure stump-shaping surgeries and rehabilitation? I asked myself, did I even want to live? I was fortunate in having a supportive family, friends, and a comprehensive rehabilitation team. Once rehabilitation started, my self-esteem began to return. I constantly had a battle with being dependent on others. I remember how I hated being fed and needing help in the bathroom. After receiving my prostheses, my hope began to return. I then began to again be able to take care of myself. I learned to use my prostheses by the time I was discharged from the rehab hospital. However, I still had a lot to learn, and I still had a great deal of anxiety about the future. What will I do? What can I do? What can I do to again become a productive member of society? Since farming was my background and agriculture was all that I knew, I felt my options were limited. I remember my father kidding me about his dairy cows not appreciating my tender touch. Through vocational rehabilitation testing, I learned I scored high and had an interest in the people service field. I then entered college and later transferred to occupational therapy. While in college, I had a lot of fears. Could I do what was expected of me? Would I need special help? Would others think I was not doing my fair share? I did, however, find that instructors were very helpful in helping me help myself. After I entered college, I broke up with my steady girlfriend. That again created anxiety. What would happen if I asked a girl for a date? Would she say yes because she felt sorry for me? or would she say no because she didn't want to be seen with a handicapped person? After I accepted myself as a person, I soon saw that others accepted me as well. All through my rehabilitation and college, I had doubts about my self-esteem and self-acceptance. Would anyone hire a bilateral amputee? Could I do a full day's work for a full day's pay? Would my co-workers accept me? Would the patients and families whom I work with accept me? I did earn my degree in occupational therapy. I was fortunate in receiving my first job where I had completed a student internship. They knew of my disability as well as my ability. In rehabilitation, it is not what you have lost, but what you have left. I like to convince my boss and my wife that even though I do not have hands, I still have 2 good legs and a well-functioning head. After college graduation, I married the girl of my dreams. That also created anxiety. Would her family accept me? Could I be a family man? I remember how difficult it was for me not to be able to hold our children after they were born. After our children got older, they adapted well to my disability. We all learned to compensate. I am now successfully employed as a registered occupational therapist, working in administration, mental health, and physical disabilities. I am living a normal life. The location of the upper extremity amputation greatly affects the function and the usefulness of a prosthesis. There are 7 levels of upper extremity amputations. 4/4 frequently is the amputation where part or all of the clavicle, scapula, and upper limb is removed. Shoulder disarticulation is where the amputation occurs at the shoulder joint. Above elbow is the term used when the amputation is through the humerus. Elbow disarticulation refers to an amputation at the elbow joint. Below elbow is where the amputation is through the radius and ulna bones. Above elbow and below elbow amputations are further described as being very short, short, standard, or long, depending on the length of the stump. An amputation at the wrist joint is called a wrist disarticulation. Partial hand amputation is the term used to describe amputation of various parts of the hand. The level of amputation oftentimes determines the type of prosthesis that will be fitted and the amount of proficiency that can be developed with it. The longer the stump, the more functional the prosthesis usually is. There are basically 2 types of upper extremity prostheses. The first type would be the myoelectric or battery-powered prosthesis. In this particular type of prosthesis, it is controlled by a battery which in turn operates a motor, an electrical motor in the terminal device or the part of the prosthesis. It is held on to the body by the socket. On this particular type of prosthesis, you do not have a harness. It is merely attached to the body by the socket. And inside the socket are small electrodes which touch the skin of the stump, which in turn activates the terminal device. The second type of prosthesis would be the body-powered or muscle-powered prosthesis. As you can see on this particular type of prosthesis, you have a harness with an axillary loop which holds the prosthesis onto the body, as well as activate the control cable, which in turn operates the terminal device, either a hand or a hook. In my particular demonstration, I will be talking only about the upper extremity prostheses, below elbow and above elbow, and both of mine are body-powered prostheses. As you can see, I have a below elbow prosthesis on my left arm and an above elbow prosthesis on my right arm. When artificial limbs are made, they try and duplicate the human body as closely as they can. As you can see, when I have my arms extended, the hooks are the same length. One isn't higher or lower. The finger part of the hook, which would be this part right here, points inward, and the thumb part of the hook points forward. When I move my elbow, you can see that my elbow is the right length on the artificial elbow and the real elbow. So that way my body is in good balance. Now I'd like to talk about the terminal device. There are a variety of different types of terminal devices. As you can see in front of me are a variety of different types of hooks. For example, a farmer would use a different type of hook than an office worker, or a mechanic would perhaps use a different type of hook than another type of occupation. In my particular case, I have a hook that has a neoprene lining in it. And the neoprene lining is very helpful for me, as it gives me a good grip on nearly whatever task I need to do. More power can be put on the hook by adding additional rubber bands. There are also available a variety of artificial hands. As you can see over here, we have a sample of some artificial hands, and this is an artificial hand that has a cosmetic glove on it, and this is another type of hand that does not have the cosmetic glove on. When an amputee is fitted, a decision is made depending on the type of vocation or occupation that that person is going into, whether he would have a hook or a hand. In my particular case, and in my line of occupation, having the hook is more practical because I can get a great deal of dexterity and a great deal of use and do the things that I need to do. With the artificial hand, I would be more limited, as they are more for cosmetic purposes as a general rule, especially for a bilateral amputee. Initially, I very definitely wanted to get an artificial hand because I figured the looks of the artificial hand would be more appealing than the hooks. Now I'd like to say something about the wrist unit. Again, there are a variety of different wrist units available for different types of prostheses. In my particular case, I have a friction wrist unit, which is merely a rubber washer in here, and as I turn my wrist, this allows me to do pronation and supination of the hook. And I can do that in a variety of different ways. To pronate the hook, I could use my other hook to turn it down, and to supinate it, put it back, or I can put it under my chin to turn it down, or put it against my chest to bring it back in the right position. And each amputee usually develops his own way of supinating and pronating their hook. For a bilateral amputee, the supination and pronation of the hook is very important. The next part of the prosthesis would be the wrist flexion unit. As you can see on this particular left arm, I have a wrist flexion unit. By merely pressing in this little button, I can flex my wrist unit, and it will flex in 3 different positions. Straight. And that's very important because it allows me to come in close, for example, in shaving or in buttoning my buttons or doing other activities of daily living. This is called the forearm. The forearm, or also socket in this particular case, is where my stump is located. And on my right arm, This would be called the forearm on the above elbow prosthesis. And the socket would be up here, since my stump is in the socket right up here. Now for the elbow mechanism, there are different types of elbow hinges. In the below elbow prosthesis, I have a leather strap. There are different types of metals or materials that can be used for the elbow strap. And on my right arm, I have the regular elbow hinge made of metal. I do not have a turntable on my particular prosthesis. Some above elbow prostheses have a turntable which would allow internal and external rotation. In my particular situation, I do not have the turntable. The next part of the prosthesis would be the triceps cuff. For the below elbow prosthesis, the triceps cuff is attached to the elbow hinge or strap and then attached to the harness. The triceps cuff helps hold the prosthesis onto the body. The next part of the prosthesis would be the harness. As you can see, the harness is attached to the triceps cuff on the below elbow prosthesis, and on the above elbow prosthesis, the harness is attached to the upper part of the arm. As I turn around, you can see my harness and how it fits over my shoulder. The harness holds the prosthesis on my body as well as helps me through shoulder action to open and close the hook or to flex and extend the elbow. The control cable is the very important part of the prosthesis that actually allows me to move the terminal device. The control cable is attached to the thumb part of the hook, goes all the way up my arm through the cable housing, and attaches to my harness. And again, as I move my shoulder, that will allow me to open and close the terminal device. On the above elbow prosthesis, which is a little more complicated, again, the controlled cable attaches to the thumb part of my hook, goes all the way up my arm and onto my harness. And as I move my shoulder, that will allow the elbow to come up, and I have a special strap across the front of my harness which controls the elbow locking mechanism, and by depressing my shoulder will allow me to lock and unlock the elbow. I will say more about that particular movement a little bit later on. How my prostheses work. Actually, once I got used to my prostheses and learned how to use them, they work quite easily. To open the hook, I have to keep in mind that I use both shoulders at the same time. The control cable is attached to the thumb part of my hook, goes all the way up my arm onto my harness. To open the hook, I have to keep my right arm stationary and merely flex my shoulder forward, and that will open the hook because my control cable is tight on my harness. To close the hook, I merely relax my shoulder again. To open, close, open, close. I do that all with shoulder action. I can do that in a variety of different ways by merely pushing my arm ahead and relaxing it, or moving my shoulder down, relaxing my shoulder. So everything is done by shoulder action. Now, the supination and pronation of the hook is also very important, especially in a bilateral amputee. For many tasks, I have to be able to turn my hook, and to pronate it, I use my other hook to pronate it. That's one way of doing it. To supinate the hook, then I could put it against my chest in this manner right here. That would then supinate the hook to bring the fingers up. So again, I can do that in a variety of ways, by putting it under my chin, like that, putting it against my chest, or putting it against my hip, for example. I could go like that. So there's a variety of different ways. If I'm sitting down, I would perhaps pre-position the hook by putting it between my knees. And once I mastered how to turn my hook in the right position and how to close and open the hook, then I was able to learn to control that and to demonstrate some of the fine dexterity that I have developed with this. I'm able to pick up a piece of cigarette ash, and by moving my hook and shoulder, I can pick up a piece of cigarette ash very carefully and lay it down on a piece of paper. And as you can see, that's still intact. And again, by moving my shoulder, all done with shoulder action, I put the stationary part of the hook onto the cigarette ash, very carefully pick it up, and put it back into the ashtray. Needless to say, the first time I tried that didn't work quite that well. Now, the wrist flexion unit is something that is very important to me. Now, the wrist flexion unit would perhaps not be used in a unilateral amputee because you'd have your good hand to do the necessary bending. Now, for a bilateral amputee, the wrist unit is very important, the wrist flexion unit. And I merely press the little button in with my other hook, and then it will lock in that position or in the full flex position. Now, that's very important because it allows me to get in close to my body. For example, if I am washing my face or shaving, it would be important that I would use the wrist flexion unit, position the hook against my body, and then that would allow me to get in close to my body to do washing or buttoning buttons or shaving or other personal hygiene needs. So once I learned to master the use of the supination and pronation and the wrist flexion unit, it made activities of daily living a lot easier. Now, the above elbow prosthesis is a little more complicated. Again, the main control cable is attached to the thumb part of my hook, goes all the way up my arm onto the harness on my shoulder. As I flex my arm forward, that will bring the forearm up. As I relax my shoulder or extend my shoulder, that will then let the arm go down. So to bring the elbow up, I merely flex my shoulder forward. To let it go down, I merely bring my arm back. So the up and down movement is relatively simple. The more complicated movement would be the locking of the elbow. I have a elbow locking strap that's attached to my harness, and as I push my shoulder ahead, that will lock the elbow. It will remain locked there now until I voluntarily unlock it, and I voluntarily unlock it by again depressing my shoulder, and that will cause the strap to tighten and unlock the elbow. So to lock, I merely tighten up the strap on my shoulder by pushing my shoulder ahead and my elbow back. To unlock, I would do the same thing. Shoulder ahead, elbow back, and it would unlock. Now, once I got used to doing these movements by using my shoulder to do various movements, it worked quite well. So if I wanted to drink from the styrofoam cup, I would merely first turn my hook in the right position, pronate my hook, keep my right arm stationary, open my hook, and put the stationary part of the hook onto the cup, and then relax my shoulder, and that would allow me then to drink from the styrofoam cup. Now, while holding something soft such as this, I would have to maintain a constant tension on my hook, because as soon as I would relax, I would crush the cup. If I did not hold it tight enough, I would drop the cup. So it took a while to actually learn how to control the tension. So if all of a sudden I forgot what I was going to do, then I would squish the cup by merely like that. And I could again straighten out the cup by very carefully doing proper shoulder movement. I can manage the cup. Now again, with practice, I do things very automatically. Initially, I had to think how to do each movement how to position the hook each time. However, now with the experience that I have, if I wanted to throw a bean bag, I would have to open the hook at the right time to release it, and I would have to close it at the right time to catch it. So I will attempt this. Missed it that time, but we'll try again. So needless to say, the first time I tried that didn't work quite that well either. But once I got used to moving, using my shoulders to move the terminal device, everything became quite automatic. An important part of daily living for me would be learning to take my prostheses off and put them on. Actually, they are not nearly as complicated as many people think. In order to take them off, I merely lock my elbow, and then I slide them off over my shoulder by moving the straps up. You can see the straps are up, and I turn around, and I merely shake them off my arms. I lay it down like that and slide my stumps out. I have stump socks on. To take them off, I merely take them off like that. Now you can see what my stumps look like. My right stump is off right at the epicondyle at the elbow, and my left is about a mid-length stump. And you can see I do not have any major red spots or sore spots. I'm very pleased that I have a very excellent fit, and I do not have any irritation even if I do a lot of work such as raking the lawn. I still have phantom limb. Oftentimes people think that if they have phantom limb that this is not normal, but having phantom limb as an amputee is a very normal procedure, a normal feeling. I can still feel my elbow. As you can see, part of the muscles that used to control my elbow are still here. I can still feel my fingers, and by still moving the muscles in my hand that used to control the fingers, it just feels as though I still have my fingers present. So phantom limb is very much a part of me. However, it is not a type of pain that really bothers me. While I have my stump socks off, I would like to demonstrate how I would put on a unilateral prosthesis. And this is an old one that I have with me. I would put my left arm in first, and I use my teeth a lot to compensate to help me put things on. So I would bite into the harness, put my left arm in, put my right arm through the axillary loop, swing it over my head, and shake a little bit. And as you can see, I now have my below unilateral harness on. And as I turn around, you can see the figure 8 harness that I have on. Now to take that off, again, I would slide it off over my shoulder first and then shake off the axillary loop and lay it down. And now I would be ready to put on my stump socks in putting my main prosthesis on. I wear the stump socks because they are very important. They absorb perspiration, and they also add a lot of comfort. I have to use my teeth to pull them on, and I also use gravity. Once I have them on, now to put my regular prosthesis on, I would put my left arm in first, bite into the harness, get my left arm in, lift up my right arm with my left hook, put the stump in, and slide them over my head. And as you can see, they are on now. And again, my straps are straight. And then I would be ready to begin my other activities of daily living. Now, one important thing that I've encountered a lot socially is shaking hands. Oftentimes people wonder, how do you shake hands with art? And I'd like to demonstrate. So to shake hands, I would merely lock my elbow and I would extend my hook. Hi, my name is Art. And oftentimes, I take the initiative to make the other person feel at ease. And if someone doesn't know what they're doing, I may say, you can just grab my hook, and that's the way we shake. Hi, glad to meet you. Okay, thank you. And I think as a person with the disability, it's important that the person with the disability perhaps make the other person feel at ease. Oftentimes, other people do not know how to respond to an amputee or to a person with a disability. And if the person with the disability feels comfortable enough to help put the other person at ease, I think that has helped me greatly in adjusting to my situation in my life. I invite you now to follow me in other activities of daily living that I do in order to get along in life. Oh my, time to get up. I wear a certain type of nightshirt, as that's easier for me to get off and on instead of button pajamas. And then I put my deodorant on. I have a special adaptation on a deodorant can, which is available from the Self-Help AIDS catalogs. And by merely putting that on, I can shake up my deodorant can and with a little shot, then I'm able to put on my deodorant, and then I'm ready to put my t-shirt on. Again, I use my teeth to help me, and my stumps to work it down. Then I put on my clean, fresh stump socks. And now I'm ready for my prostheses. Putting on socks is a rather difficult undertaking. I usually try and buy the largest socks I can get and the ones with the most stretch in. Now I'm ready to put my shirt on. In putting on my shirt, I have to do that in a rather different way. First getting on my right arm. Because I can't feel back there, I swing around, I grab the sleeve, shake it off my right shoulder, bring it across my leg where I can see the arm sleeve hole. And then I can get it on. Again, I use my teeth. I have a special button hook which I use for buttoning buttons. And this works quite well. I would put it through the buttonhole, hook the button, and use my teeth for the top two. When I get down here, I use my other hook, position that properly. And now my buttons are buttoned. Putting on my trousers is quite simple. Again, I prefer the hooks instead of the buttons. And when I tuck my shirt in, I found it easier if I would put my shirt tails between my legs in so fashion. And that will allow me to pull my slacks up and do a better job in tucking it in. I prefer this type of belt over the cloth belts, as they are easier to operate. Now I'm ready for the day. Winter clothes can be quite a challenge because if I wear something real heavy, it's rather difficult for me to get on. I prefer a hat, something like this, where I can get a good hold of it, and then I can put that on my head. I've adapted my winter coats to make it easier to put on with Velcro. This particular type of button would be nearly impossible to master with the hook, so by leaving the button on and covering them up with Velcro, it makes the coat quite functional and it still looks okay. For certain types of tasks that I do, for example, like painting, using a rake, or using a hedge clipper, I would need additional rubber bands on my hook. As a bilateral amputee, it's imperative that I have enough strength to do the things I need to do. Also, it's important for safety as far as holding things. So I have an elastrator right here that puts on a hook. I could put these on myself, but it's a struggle, so my son or wife usually puts them on. Okay. It is. Okay, thank you, Steve. I don't mind painting on a ladder. I feel very safe and comfortable doing that. And if I take the high spots using the ladder, I have a little bargaining power when it comes to painting the screens. I always enjoy a hearty meal. Milk cartons can sometimes be a challenge, so I usually like to use my knees to help stabilize them, and that way I can open them up a little easier. Cutting meat can also be a challenge. I use a 3-point contact on my hook and put my knife in my left hook, pronate my hook, then I pick up my fork, again use a 3-point contact in the fork by 3-point contact, 1, 2, 3 across the thumb, and then I can stabilize my meat with my fork and very easily cut it with my knife. And then the challenge is to gracefully lay down my utensils without dropping them. And using a fork, I have to position my hook, and I do that against my chest. That works quite well. And then I can feed myself, and this would work okay. Eating peas can be quite a challenge. And here, when I eat peas, I have to keep my elbow straight up to keep the fork level. If I do not keep my elbow up, my fork would not be level. So when I feed myself peas, I have to keep the fork level, put the peas in my mouth, and then eat. I can also mix some peas with mashed potatoes and gravy, and then I do not have to keep my elbow up. And that works quite well. In drinking from a glass, I again would pronate my hook, and then I could pick up the glass and drink from it. That would work quite well. In drinking from a cup, I do prefer using a cup that has a flat handle, such as this one. I can grab a hold of the cup, and then I can drink from it, and that works okay. If that is not possible, I may also turn my hook and merely grab the cup in the inside, such as this. Then I can drink from the cup. And if I do that, I need to wipe off my hook. Now, in eating ice cream or anything with a spoon can also be a challenge. And here, I want to demonstrate again the proper positioning. I would have to turn my hook by putting it either against my chest or against my knee, and I have to keep my elbow up in order to keep my spoon level. If I do not keep my elbow up, then I would drop the contents of my spoon. So by keeping my elbow up, that would keep the spoon level. and I'm able to feed myself the ice cream. In eating a cookie or a hamburger, that's usually quite challenging too, because I have to concentrate what I'm doing. Like a hamburger, I usually never order a very large hamburger, they're too hard to eat. Or a soft cookie is quite difficult, but I have to take a bite and control the tension on my hook so I don't squeeze the cookie. So needless to say, I'm not starving, I can feed myself quite well. Sometimes a patient or staff may be too embarrassed to ask for help in personal hygiene. The saying goes like this: the job is not complete until the paperwork is done. I'd like to demonstrate how I use toilet paper. I would first grab a long length and fold it a certain way on my knee. And then I would grab it with my hook in the center, bend my wrist, and as you can see, my hook is nicely protected. Then by leaning to one side, I can wipe and then drop it into the toilet, and then repeat the process as often as is necessary. I always welcome the end of the day and when it comes time to take a shower. Again, like other activities, it takes some preparation. I have already put some liquid soap on my washcloth and placed it right here in the tub so I can get at it later on when I need to use it. Then I also take some shampoo, and again I prefer to buy a product that has a flip top lid on. I can put shampoo in my head, I would squeeze the right amount on, and again this would work best if I do this in front of a mirror, then I can see how much I have on it. Also then I can take a comb and rub my head with a comb, and then I'm ready to turn on the shower. So I turn on this particular type of shower faucet. It works very well for me because I can dial it to the right temperature and pull it out. And if I wouldn't have that kind, I used to have to test with my toes to test the temperature of the water. So I merely dial the correct temperature, and when I'm ready to shower, I would lift the shower up, and then I would need to come out of the tub and take off my prostheses and re-enter the tub. Now I'm ready to shampoo, and with the shampoo in my head I can get under the shower and just really rub my head real well with my stumps, and that works quite well. Then I of course would rinse them off. Now to wash my face with the washcloth, I already have soap on here. I would pick it up with my teeth and then wash my face. I can wash my neck. I can wash under my arms by putting the washcloth over my knee like this. I can wash under my arms, that works quite well. And then to wash my genital area, again I put it over my stump. I can wash my genital area. And then to wash my seat, I very carefully place the washcloth on my heel, and by merely sliding my heel back and forth like this with the washcloth, I'm very able to wash my seat. And then of course I would rinse off again all over, and this would work quite well. And then when I'm done, I would shut off the shower, and I usually do that with my toes. Then I'm ready to dry. I have my towel nearby. I'll be able to rub myself all over. Like so fashion, and now I'm ready to put on my pajamas, and then I'm ready to hit the hay. Before I go into bed, there are some things that I usually do that are necessary to save me some time in the morning. One of those things would be to put my belt into my slacks the night before. The reason I do that is it's quite difficult to put my belt on my trousers when I have my trousers on. Then I would open up the bed, and I do that a certain way to make it easier for me to climb into. by putting the covers a certain way, then I can either grab them with my teeth or my stumps. Then I would also lay out certain things the night before. Like my t-shirt, if I lay that out a certain way, then it's easy for me to bite into it in the morning. Also, I put out my stump socks and my socks and my deodorant. Now I'm ready to take off my prostheses and again slide them off over my head. Lay them on a chair close by. And I set the alarm. Then I'm ready to crawl into bed. And with this fancy lamp, I can just hit that with my stump. And then I'm ready for a good night's sleep. I sincerely hope that this video has helped you learn about and understand how I adjusted to my disability and live a normal life. I ask that you keep in mind that each amputee is different and unique in his own way. We must remember that it is not what you have lost, but what you have left, and how you utilize what you have left. Throughout my amputee life, I learned to compensate. I have completely given up some activities, adapted others, and learned new ways of coping and living with my disability. One of the hardest things for me to give up was making music. To this day, I still grieve the loss of my hands. I used to play the piano, drums, accordion, and baritone horn. Since these instruments require the use of hands, I now learn to play the harmonica, and thereby I can still enjoy making music. I would like to conclude by playing a tune for you on my harmonica.